So this is a 65 years old male patient, chronic smoker and diabetic patient. He had 2 times stroke, ischemic stroke. We thought of doing angio, carotid artery angio. So this was the left subclavian artery. By mistake, we engaged the left subclavian artery. So this is a right carotid artery, and you can see the branches of carotid artery, internal and external carotid artery. This is the lateral view, and you can see the right common carotid artery. It is bifurcating into the internal and external carotid artery, and you can see mild lesion over there in the external carotid artery, and internal also near the bifurcation. So this was a mild lesion, non-significant, and this was just, we took a 3D to see the brain vessels. There was no any aneurysm, no stenosis, nothing. So this is a sort of 3D. We have taken the shot. So this is a DSA, digital subtraction angio. Same thing we can see. This was with the right femoral approach, and sheath we used is JR, guiding JR with a thermo wire. And after this right side, we wanted to again by mistake we have gone to the subclavian left. This is a aortic arch shoot, and by and large you can see the brachiocephalic trunk, which divides into the right subclavian and right common carotid, and second you can see the left subclavian, and this left common carotid was the sort of posterior. So now in this shot you can see the 3 vessels. This was some sort of lateral shot, LO, and you can see the third branch now. So we selectively engage the left common carotid, and this was the left common carotid artery. You can see the bad lesion over there, right from the common carotid artery to left internal carotid artery. You can see the ulcerated lesion is there, is almost 95%. With only 5% blood, the patient is alive. So you can see the lateral is the internal carotid artery, and whatever you are seeing in the medial is the external carotid artery. So this is the internal carotid artery, and this bad lesion, you can see this ulcerated lesion over here, right, starting from the left common carotid artery and extending up to this. This is the AP view. Could not see the bifurcation here, but you can see the lesion in the left ICA. And this is a DSA shot, digital subtraction angio. You can see the same thing, ulcerated lesion right from the common carotid artery left, extending into the left internal carotid artery. So we have planned this patient for the angioplasty to this left ICA. So generally for the brain, this ICA, internal carotid artery, the stents are tapered stent with different diameter at the proximal and distal end, and we have to do this with the embolic protection device. So we'll keep the embolic protection device just above the lesion, then we'll do the predilatation, and then we'll put a stent. That will be a tapered stent. So this was the angiography of left internal carotid artery, and as planned for the left ICA stenting.